stepwise exit from lockdown conditions. The government did set out some very specific parameters and metrics for how they would do that. I think they've communicated those to population, certainly to us. And in the different 4 home regions there, you have England, Wales, Scotland and Northern Ireland. The chief medical officers and the governments on those 4 entities have worked together in a consistent way to implement that, if some slight modifications of that. So from that perspective, testing in the UK has increased. I believe the surveillance system is capable of understanding where the disease is. I think the question we ask now for many countries is the public health system not just doing testing, but is it actually detecting cases as soon as possible after those cases become unwell? Are we immediately identifying their contacts? Are we in a position to quarantine contacts? In other words, that contacts are either quarantined at home or quarantined in a third place or a second place, and our contacts supported in that quarantine and traced over that time, with or without the support of electronic tools or apps. And I think this is a question that's facing many countries now, because countries have fought hard, including the United Kingdom, have fought very hard, and populations have sacrificed a lot to drive transmission down. It's taken time. It's taken its toll on people personally. It's taken its toll on communities. It's taken its toll on the economy. The reward for that are low levels of transmission across society. But as we've seen, the risk of that jumping back up in particular circumstances, in crowded situations, super spreading events. So we must be able to reap the harvest as such of such a sacrifice to shut down and lock down and drive transmission down to a low level. That transmission needs to be kept at that low level and driven even further down. That is going to require extreme vigilance. It's going to require communities staying on board, individuals understanding their responsibility, their contribution to their own protection, to the protection of others. The communities are involved in this process and taking ownership and feeling empowered and supported by the authorities. And that the authorities are able to react quickly to each and every case, confirm the presence of the disease or not as quickly as possible, turn around testing very quickly, and isolate cases when confirmed and identify all their contacts and quarantine those contacts. I'm sorry for continuing to repeat this, but there are no silver bullets, there are no easy answers, and each government, including the UK, needs to examine itself at every level and say, are we capable of doing that? Is every part of this system able to keep its promise? I, as an individual, promise to keep myself safe, and I promise to do everything to keep other people safe. Communities promise themselves that they will keep each other safe. Governments promise citizens that they will keep their citizens safe. Everyone has got to now live up to the promises they make, the commitments they make, and people have got, everyone at every level needs to follow through. Because what we've seen in countries that have implemented comprehensive strategies, that have reacted quickly, that have operated across multiple levels of strategy, implemented all of the things that I've just previously mentioned, they've done reasonably well and they've avoided the worst of the lockdowns. I think we've all collectively learned a lot. The issue now, and the Director General is leading a process inside our House right now, really looking at this. What have we learned in the last 6 months? What have we learned through all of these sacrifices? What have we learned about the virus? What have we learned about how to control the virus? What have we learned about our capacity at community and government level to sustain response in a coherent way, in a coordinated way? What have we learned about that? Are we willing now to learn those lessons and face the next 6 months with the resources we have? We have the tools to suppress the transmission of this virus. We hope dearly we will get an effective vaccine, but we cannot count on that. And the Director General has challenged us internally and will challenge our partners to have that discussion in the coming weeks so that we can face into the summer and into the autumn and into the rest of the year using the tools that we have in the best possible way. So in summary, I would say yes, the UK has taken a stepwise approach. The UK is listening to science. Science is still driving decision-making. And yes, every government, every level, there are setbacks, there are surprises, but the stepwise approach in the UK is the right way to go. And we just hope that all systems, including the UK, can put in place the necessary surveillance to support this going forward.
So just briefly to add some of the things that we are learning, because it is important that we look and we learn from many others. And one of the things, as countries are lifting the lockdown in this slow and staggered way that we've been talking about, is the ones that are seeing some success are doing this in a data-driven way. They're using indicators. They're using values of transmission, not only the numbers of cases that are declining, but the numbers of deaths. What do those trends look like? Looking at the reproduction number over time, looking at their testing. Are they seeing a large proportion of those tests that are actually carried out positive, or is it at a low level? They're looking at their bed occupancy. How full are the hospitals in terms of dealing with mild patients or even severe patients needing ICU? What are the isolation facilities, other isolation facilities and quarantine facilities? Are they full? How many contacts are traced? How many cases are coming from contact lists? These are helpful indicators to know where you are in your transmission scenario. And while doing this, we're seeing countries take this phased approach. You've seen phase 1, 2, 3, 4, and the slow movement of those phases, periodic, looking at it after a few weeks. Can we move to the next phase? Are we seeing that low level of transmission? And all the while having this direct engagement with their populations and with their neighbors, the populations either in a neighboring province or a neighboring state or a neighboring country. Are they seeing the same levels of low suppression of transmission? All of this is quite helpful in terms of helping others to see how is it working in your country so that we can learn from each other. But this is what we mean by a data-driven approach, constantly looking at the epidemiology, constantly looking at the data that is being collected to determine what is that next step. Can we lift even further, or do we actually have to implement again? And keeping the population engaged so that they know exactly what they need to do in each phase.
Many thanks. We will now go to Mexico. We have Paulina and Cadena. Paulina, can you hear us?
Hola.
Hola.
Hola, gracias, Tariq. Gracias a todos por escucharme esta nueva vez. Nosotros tenemos esta